Kern Valley Healthcare District Board of Directors meeting to order at 2 o'clock. The first item is the approval of the agenda, and our legal counsel, Scott Nave, does have an item that does need to be added to closed session. So,
yeah, so we had a matter that we had been working on that we thought had resolved and had gone away. And then yesterday we got a communication that that's not the case. And so I would like to discuss it. It's one case of potential litigation. And we do have to take steps fairly quickly on this. John and I have been talking about it. So I think that if we could add it, we could wrap it up in the next week or so. But I would like to bring the board up to date.
okay. So
When you approve the agenda, so under the Brown Act, when you add an item to the agenda for regular session, 4 directors have to vote, at least 4, in favor of adding the agenda. So
is there a motion to approve today's motion as such with changes? Okay, moved by Director Clark. Is there a second?
A second.
Second by Director Parks. All those in favor?
Aye.
Aye. Any opposed?
I'm just voting no for drama. No, I'm in favor.
That's 5 votes, yes. Okay.
Thank you.
Okay. The next item, we're going to do the flag salute by Director Clark, followed by the invocation by Mark Wood.
Right hand over your heart, pledge with me. Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
You bow your heads with me. Heavenly Father, we just ask that you guide our discussion this day and just guide our decision-making to better the community in its whole and in providing healthcare to this community. This elected body is the decision-making branch, and so we just ask that you give them guidance in Jesus' name.
Amen. Thank you. Okay, our mission statement is on the agenda. For anybody who cares to read it. Item C is the public comment portion of the meeting. Is there any public comment? You have 3 minutes. I think everybody is here on staff going once, going twice. Okay. Item D is the consent agenda. These are all the routine, non-controversial items can be approved with one motion unless somebody wants to pull anything.
No, that was what is that?
This is the one
Yeah,
consent.
I'd like to talk about the beta.
The beta. Is that do you want all 3 of these pulled, Gene?
Yeah.
All 3 on contracts. So this is, excuse me, this would be contracts, item 6, D, E, and F, and
4.
G. Oh, I'm sorry, there are 4, yes. Okay. Is there anything else? We'll move that to new business. Is there anything else that needs to hold anybody? Okay, with those removed separately, is there a motion to approve the consent agenda? Okay, moved by Director Clark. Is there a second?
Second.
Second by Director L. Cronin. All those in favor?
Aye.
Okay, any opposed? Okay, motion passes. Item E is reports, so we'll go to the CEO report, and Mr. John Lovett, our CFO, is still acting CEO. So, John, take it away.
As we've all heard, I'm sure FEMA is maybe not dead, but it's still on life support. And we're not sure we're going to get that money or anybody's going to get that money, but we are looking at other opportunities and other ways to fund this. And one of them we've already applied for.
You said, as we've all heard, how did we get notification we might not get it?
We've got an email and then.
Yeah, but I don't know anything about it.
Okay. Well, it was in the news and I mean, it's been talked about a lot, but we have not got formal notification that we have not received that we're not getting it. But I assume that we're not getting it because it's been discontinued. Scott, do you have anything to add to that? As far as that?
I don't. As we've seen, things can change rapidly.
Right.
And so all we understand at this point in time is that the BRIC funding is being withheld. We don't know if it'll be restored. We don't know if FEMA will continue to exist. We don't have any idea what's going to happen going forward.
Is FEMA to reduce them or to go straight from? We gotta,
It's the feds.
okay.
It's not
straight
OBS.
from- It's not going anywhere.
They are talking about pushing it down to the states, so to make it their responsibility. That's not happened yet either, though.
Bob's got a
Bob's got a
comment.
Okay, so I've reached out to Secretary No. See if she explained our situation and asked if she can reconsider.
Well,
Right?
Yeah, I think, I know that the budget that was submitted is the largest budget ever in US history. So maybe the funding will be in there.
Right. It may still be restored.
We just don't know at this point.
The only thing officially to us was that it's going to be reviewed by a federal committee. And then, of course, there's the official announcement from FEMA that says Secretary Noem has stopped all 2020 through 2023 funds. And monies that have been paid out have been paid out, but any monies that have not been paid out will be rolled back into taking care of victims of hurricanes, et cetera. So, like I said, I've reached out to her to ask her to reconsider. All we do is everything we can do.
Right. So we're looking at other options.
did you use Ross's name?
Yes.
So
Thank you.
we submitted an application to the Small and Rural Hospital Relief Program. That will not provide as much money, but we may get something out of it. But they have not really responded affirmative or negative yet. And Bob is working with them as we speak.
Yeah, our request is in with a lot of other small hospitals. Those funds, those are the funds I briefly discussed at, I think, one of the building and planning meetings, this funds that HCI has that came from the Mexico
Yep.
funds. And so I reached out recently and he responded and said that basically they need to see a contract signed to proceed with the work, and then they would look at awarding us some of the money. But obviously, we have a lot more discussion because that was at a point when we were quite certain we were getting feed. And so I was going after funds to offset our 1/3.
I've also spoke with Gary Hicks, who is our financial counselor, about other grants or even loans based on our financial position, which is strong right now. So we're just looking at other rate. We may have to kind of change what our plans are, but we'll cross that bridge in a while. We haven't decided anything yet. We are not able to go at full steam right now, but we'll be able to use at least some of it. We've got funds in reserve. I'm just hesitant to spend all those funds right now. And I think we need board input on that, of course, but we still need to keep our reserves high just in case something else happens. I mean, I just was watching the news, and the budget that was passed does not have any Medicare or Medicaid cuts right now. So that's good news for us.
And I did reach out to the consultants that we were working with on Monday and asked them to see if they could get anything, finite out of FEMA, and they have not. They said they would, but they have not responded yet.
So that was gonna be my question. Do we get notice from FEMA, official notice that we're no longer in contention, or we just go silent?
No, all we have is the official notice on the website, FEMA's website. Nothing's been sent out to any of the 2020 through 2023 grant.
We'll stay optimistic for now. We received notice of our statement of deficiencies from the EMTALA survey. They identified 3 deficiencies. Our plan of correction is being finalized. Heidi's going to mail it out this afternoon. Our new ER physician, Dr. Bowers, started at the end of March, and we received nothing but good things about it, positive feedback. We're going to discuss the physician expenses. Ross has done a review. We sent him some information on the expenses, our physician expenses over the last 5 years or so, I think. And we are looking to do either an RFP or possibly hiring them as physicians. I have requested information from the other CFOs in our district hospitals to see what they're paying. Did a Google search, and we're not sure what that's worth. But anyway, I'm going to talk to the CFOs and see if we are in the ballpark, at least as far as the hourly rate that we're paying anywhere from 225 to 300, and Google says about 175 is about right. Yeah, we'll see.
So since you've opened the door on this, can I talk about it for a minute?
And it's not on the agenda, but
Yeah, it's just a discussion.
So thanks to John and Amy, they've given me a lot of statistics on position costs, or the costs of our position contracts. So I'll pass these down if you don't mind.
Sure.
The printer ink started to run out as I was printing these, so some of the colors are weird, but looks good. What I want to bring your attention to is the figures that are bolded. In 2021, we're paying just over $2 million for ER physicians and the skilled nursing facility and hospitalists. So basically, our core physicians were costing us just over $2 million a year. In 2024, it's now over $3 million. So in 3 years, it's increased by $1 million. 50%. Yeah. And I put the chart below with the little lines on it. The orange line, or the lower line, is the rate of inflation, and the upper line is the rate of increases that we're paying our physicians. So we're way above the rate of inflation. And I don't know if we've been behind and this was a catch up, or we're just paying too much. And I think it's this board's fiduciary responsibility to ask those questions. And so what I'm asking is that this matter, I'd like to make the motion that we refer this matter to John officially.
No action.
No action?
Yeah, this is just a discussion. This is part of the CEO report.
Can't I make a referral?
The board can verbally make a referral, but you can't have a motion, second, or vote.
Okay.
But you can ask the acting CEO to look into it further,
Yeah.
of course.
That's what I would like.
Yep.
And bring back some of what you've already discovered about what the market rate is for physicians. But ultimately, what I think that we do, and we can talk about this next meeting when it's actually on the agenda.
Finance committee.
Bring it back to the board.
Good.
Is the possibility of doing an RFP for our physician services. You know, that's one option. Another option is hiring physicians as employees. We might be able to save on costs on that if we can find willing physicians to do that. But kind of with the data available in front of me, it looks like we're paying a lot, probably more than we need to. And
Russ, does that include the professional liability? That's through Beta. But have you looked at those figures?
no,
That does not
does not include insurance. These are just the values of the contracts that
If we
we pay.
change the contract with them, we could make them provide their own.
That should probably be part of the RFP.
Okay,
And if we're going to do an RFP and put it out to bid, then the responsibility for the locums, that the holes they have in their schedule would be on them and not on us. So
okay, well, I know.
that's kind of the direction I'd like to go.
I know we're paying a lot, but anybody who's been to the ER, they're awesome. So maybe they're not.
This is not a slam on any of the physicians. They're doing a wonderful job for us, but you look at the numbers and you go, holy cow,
Yeah,
they've really increased in the past 3 years a whole lot. So I think we need to examine whether we're actually paying market rate or if we're paying too much.
Any input from the board on this?
Like you said, we need to put a referral. I think we need to.
Comment, Captain, or anything?
I don't have any comments. I mean, I agree with what he's saying, for sure.
there's different types of emergencies. I mean, if you're in a big city where there's a lot of car accidents and gun shootings, there's a lot of emergency. And a lot more to it here. I think we've got more heart attacks. Is there a difference? I mean, would they get more like they're in action or something? Or,
They
I guess-
increased pay?
yeah, hazard pay.
Oh,
I actually think in the urban areas, the physicians are paid less.
That well, because there's only heart attacks normally. there's heart attacks and stuff like that here. There's not too much even, well, there's no surgery here. I mean, I don't know. I would you just along your line of thinking about being paid, are they?
I have no idea how it compares to Bakersfield or a trauma center. I have no idea.
Comparing the average
And that's what we're looking at.
pay,
That's exactly what we're gonna look at.
so the average risk also of them wanting to work here versus working at one where there's a lot of activity like that.
Yeah. Another aspect of this that I'd like examined is, do we need an ER physician and a hospitalist, or can one physician do both? I don't know if that's the case, but I'd certainly like to explore it.
Until John, you're
Can I
up.
make a comment to address what you're asking about?
Probably best if you bring it back to the next meeting. Then we can actually talk about it and
Okay,
beat it up.
Okay, are we done with this topic?
But you're okay with Ross's request to look into it and bring it back to the board for possible action? Okay.
Yeah, no problem.
Thank you. Thanks.
Thank you.
Okay. We continue our search for a new lab manager. I think we may have found one, but we're still going through some of the vetting and things like that, but I think we found one. So that's good news because the old lab manager left the last week. So we really don't have a manager right now. We have somebody doing the duties, but he's not the manager. He doesn't want the job either. Our generator project is over. Bob did a great job. They picked up the old one at a savings of about $9,000 a month, but they charged us $5,000 to pick it up. So we're still better off, and it's a great. It supplies power for way more than we even asked for. We'll talk about it.
It's been fully tested. Walking with the electrical engineer tomorrow to do a punch list, final punch list on just minor little odds and ends, complete the work. Then we will close in the project.
Are we able to run an extension cord over to the clinic?
Sure.
We will add that to our fixed asset. It's going to add. We're going to depreciate over 20 years. It'll add about $15,000 a month to our depreciation expense. Suites.
Did they, when they picked it up, did they charge us that because it was full of electricity or was it empty?
I drained the electricity, but I did
Okay.
fill it full of fuel, so they couldn't charge me for not being.
Oh.
Suite C is just about done. It's looking real good. Medical records and medical staff services. We'll be moving there probably next week or week after.
A week or two anyway.
Yeah, a week or two, but it's looking great. They'll start working on Suite D and E next. We sent a letter of intent to Kaiser for rate range. We sent them about 250. We'll get back about 550. We received 2 checks from Kern Health, equipped for 1.2 million, and private hospital direct payment of about 422,000. We submitted our annual compliance documents for our revenue bonds that we do every year. We've committed to different programs. We also had a phone call with Kern Health yesterday about a new program that should get us maybe $5 million a year. I'm not sure what our contribution is quite yet, but there will be some contribution. But it's a new program that's going to take the place of co-op and something else. And they reached out to us. Kern Health takes care of us very well, very well. So that's something new. Our Coral Health project for our charge master that Sally and Sherry are spearheading is about 25% or so done. We are looking at making some of the changes. They already started to make some of the changes. We're comparing our prices with other hospitals in our area. We are low on some, we are high on some. Lab and PT is especially higher than other hospitals, and we're looking to change that. I don't want to do a great reduction to our revenue, but we need to get it in line with other hospitals because we could be losing business because of it. Even though our payments will not change because we don't have any percentage payment contracts, very, very few at least, we still need to be in line with other hospitals as far as the charges go. We have a couple new contracts. VA, I just got another contact from Ross for VA to work out couple of little hiccups we have there. And we have another universal healthcare IPA contract, which should get us a little bit more business in the clinic MDR. And we're working with Andy Workings, who's our contract negotiator, to renegotiate some of our contracts because they have not been renegotiated probably 10 years or so. So our reimbursement hasn't changed, but our expenses are going up every year. So we need to get that more in line. And that's the end of my report. Any questions?
Any questions for John?
Oh, but it was a great report. Thank you.
Yes, ma'am.
Yes.
It was, what was I watching? I was watching Fox News.
That's not always accurate.
It's pretty accurate.
John,
They've got more watchers than anybody else.
any word on parking for other buildings?
I'm trying to get a hold, I was gonna ask Gene, do you know the person who owns that lot? I forgot to ask you that.
The one across by our lot.
Yes, in between. I'm trying to, I have two phone numbers for it, neither one worked. We have an address. I'm not sure if that works either.
I did know it about 20 years ago.
I know the lady's name, but I just can't find the phone number. We could send her a letter, but I don't want to send a letter to the wrong address either. We're thinking, Mark has volunteered to get all the weeds out of there. Maybe someone will contact us then if we start doing that. I'm not sure we want to
I
do that.
would be happy to find out who owns it
Okay,
and work on it. We've been trying to do that for 4 years.
no, we're gonna need it with all these,
Okay, all right, I'll look into it.
especially if we decide,
Several years in arrears on the accounts.
So say it's not public record.
What's that?
Yeah, it might be public.
So only one payment.
Okay, so she caught it. It was a while back.
we got some of the, who gave us that information? Somebody gave, one of the realtors gave us information, but the phone numbers were wrong. So,
John, you should just go to the Kern County Assessor website, pull up the address, pull the doc number.
That's where we
That's where we got
made the
it, yeah.
document.
Yeah.
A couple months ago, got no response, so we tried calling the phone numbers that we couldn't find.
Yes. If you've got that document with the address from the assessor's office, that's where they're mailing the taxes to.
That's where we mailed the letter.
yeah.
Okay.
Yeah, she's not getting it. That's why she didn't pay it.
Or they're not interested in doing anything with
She
it.
said before that she was interested, but what I heard, that's what Tim said before. So we need, oh no, that didn't talk. We need more parking, especially pharmacy over there. We're gonna really need a lot of parking. But even now, we need, even with just HIM and medical records and everything coming over,
You're gonna be running tight.
we're already tight right now. We're not going to open spots.
It could be in probate too. I mean,
Right.
it's hard to
Try and
say.
get it cheaper that way. That'd be good.
Well, not necessarily, but you know, 50,000 about 20 years ago, it could be worth 10,000 now.
I think we saw, what did we see, 85?
That's value.
That doesn't mean nothing.
That's that's the only information we have.
Yeah, if the county says it's worth, it's probably worth 2,000.
Any other questions for John?
Yeah.
Oh, go ahead.
So back to your comment about no cuts to Medicaid. I think that's great news if it's true. I don't believe it.
It's in the budget. There's no cuts in the budget. That budget just. got
Have you actually read that document? I haven't either. I'm not gonna believe it coming from Fox.
Okay.
Well, I get Social Security and I have received a letter stating that there are no cuts to anybody that is receiving Social Security if they're truly eligible for it.
So a couple months ago, the proposal in Washington was to cut Medicaid by $880 billion over the next 5 years. And their budget proposal included that cut. I don't know what happened today. I don't have the details. But if somewhere in those documents, there's big cuts to Medicaid, we need to be aware of that and planning for it because it's going to hit us hard.
The one thing, Russ, that I heard, not that I would look on Fox News, but the able-bodied, years ago, if you were under 65, capable of working, able-bodied, you couldn't get it. Now, absolutely anybody can get it. Everybody's getting it. That's
What, Social
able-bodied.
Security?
No, Medicaid.
Medicaid.
Medi-Cal.
Medi-Cal.
And they made it easier the last few years to get.
Not easier, they can give it to
Right. So they're talking about making people, yeah, you're right. Go ahead.
That's not reasonable. To me, it's not. Maybe to Russ it is, but not to me.
What I'm worried about is our skilled nursing facility is funded by Medicaid money.
Yeah.
Completely.
Yeah, that's people that
Kern Family Health Systems, who's a big
understand they weren't.
payer for our services, is almost entirely funded by Medicaid money.
changing
If
some,
that starts to get chipped away,
changing some of the food stamps, the distribution,
Let's,
stuff like that.
okay, let's one at a time, please.
Okay.
I know it's not on the agenda, but I mean, but it is stuff to think about in the future.
Right. So
So,
we are making plans for that if it does happen.
so through our associations, the more information you can gather on what's actually happening in Washington, the better.
That's what I'm looking for.
Thank you.
Yeah, that's what I'm looking for. We have a meeting every Wednesday with the District Hospital Leadership Forum. And they were talking about, they've got a representative in Washington, representative in Sacramento, and they bring that up. every time.
Great.
And they think that.
So we need some inside
Right,
information.
and that's what, we have a meeting with them tomorrow morning, actually, too.
Super.
any other questions for?
No,
John?
no,
No, sir.
I'm taking contributions for people to learn how to do the Trump dance and get an instructor. And Ross, can I get you?
Nice to inject a little bit of comedy. Okay. All right, thanks, John.
I'll throw $20 towards Ross's direction.
I could use some dance lessons, but it's not gonna be that dance.
Okay, we don't have any old business this afternoon, so moving to the new business, and we have a security services 90-day review. Didn't say who was going to discuss this one. Is this Bob or John or Mark? Mark?
Yeah, that reports to me, so
Okay.
we're,
Requested before we made the transition to do a 90
Yes.
we've had no breaches in the night shift or the day shift. We've had a solid contingent of security here for 24 hours every day since we started it. There's no, there are occasions when they have to intervene and de-escalate situations. Those come up. We're also looking at getting a phone, a better source of communication when they're out doing their rounds, to be able to have every nurse's station be able to get them wherever they are on the property, so that we can reach them. So Carrie's working through that right now. So I can't tell you how much money we've saved. It would be a simple math problem, but certainly do that for you if you want to see that in finance.
I think I did that once already.
But we knew it was gonna be
Yeah.
cost effective.
Yeah, I think it was a good move, so.
So there are no holes in the schedule. It's working out.
Holes in the schedule.
Oh, super.
Yeah, we switched into 12-hour shifts, so now it requires fewer bodies, but on the weekends, we still have a couple of per diem people, and we're gonna have to maybe hire one per diem person to cover vacations during the summer, but other than that, I think we're in good shape.
You have periods of where nobody's available? Like
We have not had that in the last 90 days.
Okay, cool.
Any other questions for Mark? It was just discussion on an action item. Number 2 was the discussion on beta that was pulled from consent. Director Parks, you had some questions on
Okay, let's
the
see.
beta.
Let me find it. What page is it?
It is 33.
Starts on 43, so,
Well, this was the list.
That was the list of contracts.
Uh, Thanks. And I think that's you. I'm confused if it's annual or not. It says renews annual, but is it paid monthly? Is that how this is reading?
paid monthly, annual, or
I know it says renews annually, but over there where after the amount, it says annual, monthly, annual, quarterly. Is that how it's paid?
based off of the A and N column, and the renewal is annually.
Okay, so some of it's paid monthly.
We also receive a rebate back from Beta 2 times out of the year. So that's a little bit overstated. That's what we pay, but we also receive a rebate twice a year from them.
That liability is an extremely high amount. comes out to around $500,000 a year. Don't look like much, 41,000. Can we look into that? On what the true costs are and why?
What the what are, excuse me,
Cost.
what the costs are?
Yeah, I see what it's saying here.
Right.
And for the, okay, let's see, the auto's paid out, Ellie, that's pretty cheap, so that's not an issue. I didn't know if Mark was causing it to go up because of not the way he drives, but his vehicles. But could you bring a little better breakdown of what it is?
Sure.
Maybe at the next finance meeting.
We are still negotiating, really, it's not renewed yet, we're just submitted the documents. So we're still waiting for their estimate of what we have to pay. This is last year's numbers, I believe, right?
The buildings, everything should renew together. And
Well, they're all separate applications, so thank you.
if we could get a little more information,
Sure.
let's see.
Yeah,
It should be a good deal for us, but there's times when it's not. We could take part of it out.
Bid is usually the best way to go for a hospital, most of the times. I mean, I've sent it out to bid a lot of times, and bid always goes back best.
I'm assuming the liabilities might is probably like the malpractice insurance or not. Oh, that's all.
What I was getting at, we need a little
That's
better breakdown.
Probably why
of what it is.
it's monthly, probably why it varies so much. Okay, so what, Director Parks, do you want to table this or, since it was pulled from consent,
We should have more information by the next board meeting, most likely.
Okay.
We're just waiting for them to respond. We sent the applications all in and we're just waiting.
Yeah, it's July, is that the renewal date?
July 1st, our fiscal year.
Right. Okay, let's table it till we look into it next,
All
a
right.
little more.
do we need a motion to do that? Just wait until the next, okay. Any other questions on the beta? And all along. Oh, we're already at director's comments. I'm not appearing on the agenda.
Nice.
Okay, we'll start with Director Parks and then we'll move our way down.
Personally, I think that Bob reached to the right person. I think we'll get that along if it's looked. If they just don't look at it, then we won't get it. But, so I'm still more encouraged than I ever was. So, but other than that, it's been fun working with, Russ.
So even though you guys disagree, you guys still get along.
You know why? Because they're farther apart.
Director O'Connor, any comments?
Yeah, my only comment is, John, thank you for your report. I mean, it was very concise and informative, and I appreciate that. So, other than that, no, I think we're just moving right along. I'm kind of anxious to see how the FEMA stuff goes, but I mean, it's out of our hands, so we'll just have to wait and see. That's all I have.
Director Clark?
Nice to see all the faces in the room. I don't have to look at the back of your heads. You don't have to look at the back of mine. No, I'm just glad everybody's here. Thank you for being here. Appreciate it.
And Director Elliott.
Thanks. I've got three things. First, I want to thank Amy for digging through all the past back historical records for all those numbers. Thank you. I know that was a lot of work and I appreciate it. The second thing with the FEMA, the article that was in the Washington Post over the weekend basically said the Trump administration's philosophy is disaster relief should be the responsibilities of the state. And he just basically wants to dump FEMA and have it not be a responsibility of the federal government. So if that's the case, we're not going to see that money. So hopefully that's not the case, but we'll see. The third thing is, I know you all know I sit as a board member on Kern Health Systems. And I'm sitting on this ad hoc committee to review the ordinance of that particular organization. And as part of the ordinance for that organization, when Kern Health Systems has reserved money left over, and it happens occasionally, not every year, probably won't happen this year, but it did last year to the tune of about $20 million. And in the ordinance, that money is earmarked. 80% of it goes to safety net providers. So, and they list safety net providers as Kern Medical Center, Clinica Sierra Vista, and Omni. The only problem is we're a safety net provider also. Our clinic is a safety net provider. Our hospital is a safety net provider. And so I was trying to, explain this to the other committee members, and it was all weighted heavily against Kern Valley. Tim was on medical leave, so he wasn't able to vote. But the composition of the committee was weighted for the status quo. So it will eventually come to the full board, and the full board will weigh into that. But I just want to let you know, I'm trying very hard to make sure that they understand, this entire board understands, there are more safety net providers in Kern County than just those 3 listed in the ordinance. I'm trying to make headway in that, and hopefully that'll happen in the future.
That'd be great.
Thank you.
That'd be really great.
In the other allocation, we are considered, though, because we get
By
10%
law,
of that.
we are.
Yeah, we get 10% of that's how we
That's
get how we get our IGT money.
Exactly. By law, we are, but in the local ordinance, we're not. So, it just needs to be changed.
But 10% yeah, we'll take it.
Yeah.
Yeah.
Thank you, Pete Schilling.
Yeah. It's funny. It goes way back to Steve Schilling. At the time I was an analyst in the county admin office, I was the facilitator for that group. Well, I know where it came from.
Well, thank you, Ross, for your help on that. And thank you for putting this together as well. This next month for sure. And just to reiterate, nice seeing everybody here this afternoon. And John, thank you for doing a good report as well. And I understand you've put out some fires since you've been kind of acting CEO. So, but thank you for helping out with that. And I think you're doing a good job. So
Thank you.
Well, with that, we're going to adjourn to closed session at 2:38. So the rest of y'all have a great rest of your afternoon. And okay, almost welcome.
All right.
I saw this. If you want to just forward this to yourself, that is the actual FEMA notice, and it does come across a little different.
We're back into open session, so we will move to the closed session report.
Yeah, so in closed session, council, CEO, and the board briefly discussed the Benson and Volcava matters. There was no update for Rostad. And then council and the board discussed one case of potential litigation. The board gave direction to the CEO. Other items were discussed. That's it.
Okay. And with that, we are adjourned at 2:51 p.m.
Good job.